You're pregnant and you're in the middle of your workout session when all of a sudden you begin to feel a sharp pain in your lower abdomen. Is this a reason for you to stop your session? And what do you do when this happens? Hi, my name is Dr. Natasha Lo Osho, and I am a board certified OBGYN and a certified personal trainer. I am also the owner of Bump Fitness Club, located here in Chandler, Arizona. Um, I often get asked, how do I know when to stop working out or to stop my workout session for that day? So there is not uncommon during pregnancy to have some kind of discomforts or things happen throughout the course of your workout, and you're just wondering, okay, is this, or do I need to stop? Can I keep going? What do I do in this situation? So for example, it's not uncommon to have what's called round ligament pain. So those are the sharp pains, your lower belly that kind of radiates and shoots towards the vagina. The reason why you get round ligament pain is because certain movements can stretch the ligaments that attach to the uterus. And so, when those happen, as opposed to completely stopping your workout, you can consider doing something different or maybe changing position. And if it goes away, then you're good to continue. The other thing that can happen is you can have some mild cramping. Usually that's a sign of dehydration. So that's why we always say make sure you're well hydrated going into your workout, and then also that you hydrate after your workout. So there are a list of things that can occur that we actually do recommend you stop your workout session for that day. It doesn't mean that you have to stop your program completely, but you certainly need to put a pause at that particular moment and reach out to your healthcare provider for further recommendations. So that is what I want to talk about today. What are the things that we need to look out for that is your indication or cue to stop your workout and then to seek further advice? So the first thing would be any bleeding from the vagina. So certainly if it's heavy bleeding like a period, bright red blood, but also even if it's light and spotting, and then I would recommend stopping your workout and then reaching out to your provider for further recommendations. The other thing that we want to be mindful of is if during your workout you're feeling faint or dizzy. Now, I preference that with saying, make sure you are well hydrated going into your workout, because if you're not well hydrated, even when you're not pregnant, you're gonna feel faint and dizzy. Also, make sure that you eat a snack within 30 to 60 minutes of your workout, or you've had a meal within about 2 to 3 hours, because otherwise, if you get to your workout, your body is using its energy stores, and if you haven't provided any extra energy sources, and then it can decrease your sugar levels, and that can make you feel lightheaded, dizzy, or faint. So make sure, in terms of that, preparation is key. But the other thing is that we have to be considerate or mindful of in pregnancy is position changes. And so always make sure whenever you're changing positions and you're going from movement to movement, that position change is slow and deliberate. Sudden changes can definitely cause dizziness, lightheadedness, and then a faint feeling. And so, for example, if you're doing a floor workout, let's say you're doing clamshells, and you go from doing your clamshells to doing like standing hip abductions, or standing leg raises. Well, going from a lying down position to a standing position and doing that kind of back to back can make you feel dizzy, because when you're standing up, the likelihood, or typically what happens, is the blood will rush to your legs, and then resulting in the dizzy feeling. So what I typically recommend is grouping your workouts together. So consider doing all of your floor workouts, kind of grouped together, and then transition very slowly and deliberately to the standing position, and then complete your standing workouts. So that way you're not like lying down, standing up, and kind of back and forth. All right. The other reason to stop your workout early is actually, this would be a reason not to even do a workout for today, is if you're feeling short of breath before your workout. And so pregnancy comes with a lot of changes to the body, particularly with our lungs. So as the belly grows, your lungs can't expand like they used to. And so you can have a sensation of feeling more short of breath. Maybe you're taking more deep breaths. And that's pretty common. But if you literally cannot catch your breath, and then definitely skip your workout for that day, and then reach out to your healthcare provider for further recommendations. And then the other thing that kind of plays into that, let's say you started your workout and you're feeling like really, really winded, and you can't push your intensity for that day. It is okay. If you're not feeling like you're able to catch your breath and then stop, you can always try again another day. The other reason to end your workout early would be for chest pain. So, and this is particularly true if you've never had chest pain before, and then all of a sudden you're in the middle of your workout and that's happening. Definitely stop, reach out to your healthcare provider, and then so they can give you further recommendations. The other reason to end your workout early is muscle weakness. Now, muscle weakness is different from muscle soreness. So if you're in your routine and you're feeling those muscles activate, that's a good thing. So you want to make sure whatever exercise you're doing, that you feel the activation of that particular muscle group. So for example, if I'm doing let's go back to clamshells. So if I'm doing clamshells and I know that is a more lateral hip exercise, and then I should be feeling the muscles activate in my lateral hip. And that is perfectly normal. You may even feel it like a day or two after. And again, that's perfectly normal. But muscle weakness is I can't even raise my leg to do a clamshell. I can't raise my arm to do a fly or a chest press. Like you literally cannot, you don't have the strength to use the muscles that you want to. And so that would be a reason to end your workout early. Calf pain and swelling, particularly if it's one-sided. And so if you all of a sudden get pain in your calf, the one leg is significantly more swollen than the other leg, and then that's a reason to stop your workout and then reach out to your healthcare provider. And I know swelling can be tricky because swelling comes, it's a normal thing that comes with pregnancy. The good thing is as you stay active, and the more active you are, and then you do tend to have less swelling. And so it might be a little bit easier for you to differentiate, okay, this swelling is new and completely different than anything I've felt up to this point. So I'm just going to reach out to my doctor or my midwife. The last two may seem self-explanatory, but it is on the list, and it's something that we should definitely talk about. So regular painful contractions. It is not uncommon to have some mild cramping during a workout session. Again, that tends to correlate a little bit more with your hydration status. So if you enter your workout well hydrated, you've drank water throughout the day, the chances of you having that kind of mild cramping is typically lower. But if you are having regular, consistent, and painful contractions, and they're getting stronger and stronger and literally taking your breath away, you need to end your session and reach out to your provider. All right. And the last thing is leaking amniotic fluid. And so if you think that your water's broke in the middle of your session, stop and then reach out to your provider. So again, just to kind of summarize the things that we are looking for that will be an indication to end your workout early would be any bleeding from the vagina, feeling faint or dizzy, and there's no explanation to why you're feeling that way. You know you hydrated well, and you know that you're not changing positions from lying to standing frequently. If you have shortness of breath before you start your workout, if you're having chest pain, muscle weakness, remember weakness is different from soreness. So weakness is I'm having a hard time using my muscles. If you're having calf pain or swelling, particularly if it's one-sided, and then regular painful contractions or leaking amniotic fluid. So these are all reasons why you should end your workout early and then reach out to your healthcare provider. So again, my name is Dr. Natasha Lowe Osho, and I am a board certified OBGYN and a certified personal trainer and owner of Bump Fitness Club here in Chandler, Arizona. I hope that you found this content helpful. If you like what you have seen, please hit the like button below. Feel free to share this with your expected friends and family. And then also, please subscribe to my YouTube channel. There will be more educational content to come in the future. And then as always, if you have any particular questions, feel free to reach out to me at natasha@bumpfitnessclub.com, or you can call or text 480-242-6856. All right, I'll see you later. Take care.